things to keep in mind when deciding whether or not you want to have reconstructive surgery, and obviously it's a personal choice. And I liked the 4 little notations here, and I'm going to read them, and maybe you can chime in on
Sure.
each one, doctor. Before you decide, keep in mind the emotional and psychological well-being.
That is probably the most important thing. Emotional, psychological well-being is not only important in breast cancer, but any kind of treatment you have, whatever disease, because having a positive outlook is really important because that affects your body's ability to recover. We know so much about the brain, yet we don't know how our mood affects our body to heal. And you know, people, and again, being from Chinese background, my father was an acupuncturist. And he talked a lot about, you know, the different nerve endings, how that neurochemical effect affects our body. And I think it's actually really important because we don't know enough.
Exactly. 2 more things, recovery time and the condition of your skin are things to also keep in mind. Whether you're having a breast reduction or you're having reconstructive surgery, the healing time, recovery time, I would think could be different for everyone.
For sure, everyone's body is a little bit different. What they go through is a little bit different. Also the type of surgery. Typically for the implant and what's called an expander surgery, your recovery time is quote unquote 1 week in terms of pain and the scarring and the healing, but you know, not a lot of upper body movement for the first few months afterwards. When you do the tissue surgery where you use tissue from your own body, the recovery is going to be a little bit longer because there's more surgery sites and you're going to have some more pain. But again, there's less restriction because there's no implants, you're using your own tissue.